Solving Family Issues Part 1. Introduction to the module. This module discusses the impact parental mental health, substance abuse, and domestic violence has on children's emotional well-being and development and the risk factors involved. You will also learn how this affects parenting and what support can be given to children and families. The topics discussed in this module are: what are mental health problems? Parental mental health and the impact on children of different ages. The impact of parental mental health problems on parenting. Intervention and support for children and families with mental health problems. Parental substance misuse, what it is, and how it impacts children. Assessing the risk of parental alcohol and drug misuse. Intervention and support for children and families with parental substance misuse. Domestic abuse, what it is, and how it impacts children. What are mental health problems? Mental health problems are diagnosed by a medical professional. They affect a person's mood, thinking, and behavior. Approximately 1 in 4 people will experience mental health illnesses at some point in their lives. These include depression, anxiety disorders, OCD, bipolar disorder, schizophrenia, personality disorders. A person may be genetically or environmentally vulnerable to mental health illness. These factors include poverty, unemployment, physical illness, disability, social isolation, relationship breakdown, childhood neglect or abuse. 68% of women and 57% of men with a mental health problem are parents. These conditions vary significantly in severity and can affect parents during the perinatal period, in pregnancy and after birth. Many children will grow up with parents or carers who have some degree of mental illness. The impact on children will depend on their circumstances, the severity of the parent or carer's illness, and how much support they receive. Different factors will often impact different age groups. Parental mental health and the impact on children of different ages. Infants aged 0 to 2 years. The mother's mental health during pregnancy and the first few years of life play a crucial role in the infant's development, both emotionally, cognitively, and physically. Studies show that prenatal stress or anxiety have a significant effect on the fetus and emotionally impacts children into mid-childhood and often beyond. Babies may be born with irreversible brain damage and growth problems, or even die before birth due to issues such as fetal alcohol syndrome, if the mother has a drug or alcohol addiction. Babies will likely suffer from withdrawal symptoms and be difficult to manage. Their risk of being born prematurely is higher, and they often weigh less. Postnatal depression and anxiety are common after the baby is born and can affect parents bonding with their baby. Depressed and anxious mothers may be more irritable, proven to negatively impact children's behavior and emotional responses as they grow up. They may interact and play less with the infant, resulting in insecurely attached children. Chance of neglect increases, for example, malnourishment, lack of personal and baby hygiene, living in a dirty and dangerous environment. Neglect or understimulating behavior can delay the infant's cognitive and speech development. Children aged 3 to 4 years. Risk of being left in unsafe, unhygienic environments alone, with drugs and needles, while their parents or carers go out to buy drugs or alcohol. They could be left with unsafe adults and witness domestic abuse. May be malnourished and with insufficient clothing, if priority has been given to spending money on drugs or alcohol. Their personal hygiene may be neglected. If there is hostile and aggressive behavior, neglect and rejection, the child's mental health can be significantly affected. Cognitive development may be delayed due to lack of stimulation or learning or peer social. They may try and take responsibility, such as protecting a mother from domestic violence and resulting in injuries. This age range is particularly vulnerable to bad parenting, as the children may blame themselves for the neglect and their parents' problems. In a peer environment, they may try and copy violent acts they've seen. They may have problems forming other relationships due to constant fear, anxiety, and mistrust. The child may take on tasks that are dangerous for their age due to lack of appropriate care. Inconsistent parenting can cause faulty attachments and emotional instability. Children aged 5 to 9 years. There may be a high risk of medical problems or injuries. Often children suffer from psychosomatic problems due to anxiety from domestic violence, such as difficulty sleeping, bedwetting, headaches and stomach pain. They can experience shame and even guilt for their parents' behavior and blame themselves. Can be very socially anxious around peers. There can be delays in cognitive development, especially if they are not appropriately educated. These children are also at increased risk of developing a psychiatric disorder in childhood, adolescence and later in adult life. Young people aged 10 to 14 years. High risk of developing mental health and behavioral problems. Having to take on a caring role to help ill parents, which can be very demanding emotionally and physically. Can get extremely distressed from disturbing situations, such as if a parent attempts suicide, takes an overdose, or if they witness violent behavior. Shame over their parents' illness, resulting in limited social interactions or bullying. May have less money if their parents aren't able to work. Worries that they would be taken into care and that the family will be split up. Possibly having to go through puberty without support. Teenagers aged 15 and over. Previously stated issues are still relevant for teenagers. They may struggle at school and risk exclusion. There is a high risk of them being involved in accidents. Likely to have low self-esteem due to inconsistent parenting. They may be more aggressive to others. Can develop extreme emotional difficulties, leading to suicidal behavior. May become involved in crime as a way of getting money. The impact of parental mental health problems on parenting. Children living with parents or carers with mental health problems may not experience any abuse or neglect. Many parents are still able to give their children safe and loving care, especially if they have the right support. However, there is a risk that parental mental health problems may significantly impact children. 1 in 4 people in the UK will suffer from a mental health issue each year. 15 to 23% of children in the world live with at least one parent who has a mental health problem. These are some examples of how mental health issues may negatively affect parents and children. Experience extreme mood swings, resulting in children feeling scared and confused. Have trouble focusing on the child's needs, making them feel rejected and unloved. Struggle to follow routines, such as taking their children to school, mealtimes and bedtimes. neglect basic hygiene both for themselves and for their children. Intervention and support for children and families with mental health problems. As a family support worker, it is vital to focus on the children's well-being at all times, to assess the family's situation and provide the right support. You will need to communicate closely, to coordinate with other services. The types of support you can provide include educating children and young people about mental health problems. This is extremely important, that children receive accurate information which they can understand. It will also help them develop coping skills and realize that their parents' illness isn't their fault. They may also gain empathy towards their parents and improve communication. This can be done through workshops and other methods. Mentors and advocates for children. Children will feel more supported if they have a mentor they can contact if there is a crisis, and who they can talk to about their parents' condition. Mentors can also be the child's advocate if required. Peer support for children and young people. Peer support programs enable children to bond with others who are in a similar situation. This should improve self-esteem, their ability to cope, and improve their understanding of mental health conditions. Group support for families. Multi-family meetings can be arranged, where they can meet to talk about their experiences. This helps people feel less alone, reduces stigma and can help prevent relapses. A whole family approach. As everyone in the family will be affected, a whole family approach is necessary. This enables each family member to understand each other's perspectives, to help avoid misunderstandings and improve communication. Practical support can be offered too, such as advice, setting goals and staying well plans. Families may need to be referred to other services also. Monitoring progress. Throughout the intervention period, the family's progress needs to be tracked. If a parent doesn't participate with the support offered, then action must be taken. Children may be at extreme risk from being neglected and abused, to a point where all other support options have failed. In this case, they may need to be taken into care as a last resort. Looking after parents during pregnancy and early years. It is crucial to make sure pregnant women and mothers feel supported, to prevent or help with postnatal depression. This reduces the risk of the child developing future mental health problems. If a mother is experiencing mental illness, it is essential to provide regular support, to make sure the baby is receiving adequate care from the mother. Otherwise, crucial early bonding may be affected, and it will be traumatic for the baby. Family and friends should also be involved in the care plan. Mothers need to be encouraged to connect with other new mothers. Parental substance misuse, what it is, and how it impacts children. The majority of parents or carers don't pose a risk to children with moderate alcohol or drug consumption. However, the ones that misuse substances can be a threat to children's safety and emotional well-being. What is substance misuse? Substance misuse refers to when a person's drug or alcohol use becomes harmful and endangers their health or others. This may lead to dependency on the substance, where they continue taking it despite the consequences, physical illness, psychological problems, or physical accidents, social, health or financial problems. Alcohol misuse. Alcohol misuse refers to dangerous drinking and alcohol dependency. This can result in physical, social and psychological issues, as well as accidents caused by excessive drinking. Alcohol dependence is when someone craves alcohol and continues to drink, despite harmful consequences. Drug misuse. Drug misuse refers to excessive, frequent consumption of psychoactive substances. These can alter mood, consciousness, thought processes and behavior. This can result in damaging physical, mental, social, and legal consequences. The impact of parental alcohol and drug misuse on children. Parental substance misuse can have devastating consequences, not only on their health and lives, but also on their children's. Pregnant women who misuse substances can cause brain deformities in their babies, resulting in various lifelong illnesses. Babies may also have a lower birth weight. With premature delivery, and after birth, they can experience withdrawal symptoms. Children may have to take on the role of caregiver to their parents or siblings. Their education can be affected due to missing classes. Social services may separate children from their parents for their safety, or adults may be hospitalized or put in prison. Parental substance misuse and child abuse. Parents with higher substance abuse usage are more likely to inflict severe maltreatment on children. Countries with high rates of hospitalization due to drugs and death from overdoses end up with more significant numbers of children in foster care. Parental substance abuse can result in various forms of child abuse occurring, such as neglect. Children may be neglected by living in unsafe and unhygienic accommodation and experience poverty, so they may not have suitable clothes. They can be exposed to toxic substances, such as alcohol, drugs and needles, and be part of chaotic and illegal lifestyles. Emotional abuse. Often children will blame themselves for their parents' behavior and feel guilt and shame. Parents may be emotionally distant and have limited interaction, making the child feel rejected and unloved. Psychologically, this will affect them significantly and often causes behavioral, cognitive, and relationship issues. Physical abuse. Numerous studies show a strong link between alcoholism in parents and the physical abuse of children, mainly from fathers. Other risks. Parents may get involved in crime to fund their addiction. This increases the risk of children being around other dangerous adults and potentially experiencing sexual abuse. Assessing the risk of parental alcohol and drug misuse. Social care professionals need to look at the situation as a whole when assessing the extent to which parents pose a threat to children's safety. There are various vital factors to take into account, such as the child's age, as well as their cognitive and emotional development, their environment and how safe and clean it is, how the consumption of drugs or alcohol affects the parent's behavior, the ability of the parents to meet the children's needs, the relationship between the child and the parent, if the parent is willing to get help and support for their problems. Urgent risks to the child's safety need to be identified and distinguished from other factors that could affect their well-being, which could be accommodated with the appropriate support. Whether there are other family members or friends who can give the child the right care. Carrying out risk assessments. It is essential to allow the child to express themselves freely and to listen attentively and record what they say. Identify the individual child's needs and whether they act as a carer for their parents or siblings. Ask questions about the substance misuse of the parents, whilst reassuring them they are not being judged. Make them feel heard and understood. Be encouraging and give them hope, as they have opened up about their problems. Include other family members or friends who want to help. Coordinate and gain opinions of others who are involved with the family, such as health professionals or teachers. Discuss the options of support that are available for them. If you decide that children are at risk, then create a care plan and track progress. Intervention and support for children and families with parental substance misuse. Support needs to be tailored to suit the family's circumstances and depends on the level of substance abuse involved and how it is impacting the family. There are various types of support available. Practical support. This will be focused on day-to-day practical assistance, such as traveling to nursery or school, helping with schoolwork, and organizing medical appointments. Help can also be given with sorting housing, financial and benefits issues. Family and parenting support or therapy. This can help the family deal with their emotions, with an emphasis on recognizing and changing negative behaviors. This should enable the family to communicate better with each other. Children need to be provided with a safe space where they can talk about how they feel and be reassured that they are not to blame for their parents' addiction. Friends and family support. Others who are involved with the family need to be spoken to as well, hearing their opinions and educating them on the consequences of substance misuse. Drugs and alcohol services. Substance abuse support services need to understand that the safety and well-being of their clients' children are vital. They must share information with relevant people if it's in the interest of the children. Monitoring progress. It is essential to track and review the children's progress throughout the intervention and respond accordingly. Also, the parent's drug or alcohol misuse needs to be monitored, keeping in mind that improvements don't necessarily mean improved parenting. They will still need a lot of support. Taking children into care. This should only be carried out as a last resort if the children's safety becomes critical after being in an abusive and neglectful environment for too long. Foster carers will need appropriate training in supporting the children if this becomes the case. Domestic abuse. What is domestic abuse? Domestic abuse is a pattern or incident of bullying, controlling, threatening, and violent behavior between people in the same household or who are in a relationship or were. It doesn't just mean physical behavior, it can also be psychological or emotional. Types of domestic abuse. Physical, hitting, kicking, punching, etc. Sexual abuse and rape. Psychological or emotional, could be bullying or trying to control someone. Harassment and stalking. Threatening to kill someone or someone they love. Signs, indicators, and effects. It is sometimes hard to tell, as it often happens at home and is kept secretive. There may be physical evidence, such as bruises or cuts on someone. Children experiencing or witnessing domestic abuse often suffer from depression and anxiety. They may show signs of antisocial behavior, struggle at school, become withdrawn, aggressive, self-harm, or have suicidal thoughts. Who is affected by domestic abuse? Anyone can be affected by domestic abuse, whatever their gender, race, age, or sexuality. If there is domestic abuse happening in a child's home, eventually the child will be at risk from other forms of abuse, sexual, physical, emotional, or neglect. According to the World Health Organization 2016, around 1 in 4 adults reported being physically abused as children. 1 in 5 women and 1 in 13 men stated they were sexually abused as children. How domestic abuse affects children. Domestic abuse will always have an impact on children. It is harmful to children to be living somewhere where domestic abuse is happening, and it causes severe distress. Exposure to domestic abuse is a type of child abuse. It can cause them to be afraid of their parents and not bond with them. Children may worry their parents will divorce because of it. Domestic abuse can have dangerous, long-term effects on children's brain development, mental health and behavior. Children and young people witnessing domestic abuse. They can experience it directly or indirectly by seeing a parent's distress or injury afterwards, hearing it going on in another room, being hurt from trying to stop it or being nearby, seeing broken furniture afterwards. Teenagers experiencing domestic abuse. Domestic abuse can occur in any relationship, affecting young people also. They might not recognize it as abuse, or may be scared or ashamed to tell anyone. Teenagers often experience anxiety over future relationships due to witnessing domestic abuse. Risk factors for all child abuse and neglect. There are certain times when children are at high risk of abuse. These are periods of transition or adversity, when things become more stressful and relationship conflicts are more likely to occur. Combined with existing mental health or substance abuse problems, domestic abuse can escalate. Times of transition or adversity include during pregnancy, after having a baby, moving house, separation, divorce. Summary. In this module, you have learnt how, as a family support worker, you can help children and families through solving family issues. About parental mental health problems, substance abuse problems and domestic abuse. The negative emotional, social, physical and developmental impacts of these problems on children of different ages. That children are at high risk when living in a household with parents or carers who have multiple problems, mental health issues, drug or alcohol addiction and domestic abuse. That domestic abuse can have dangerous, long-term effects on children's brain development, mental health and behavior.